So yeah, so let's begin. Hi Aruna,
Hi,
lovely
how are you?
to have you. Lovely to have you, and thank you so much for doing this. What time is it there?
It's around 8:30, just 8:29, 8:30 Saturday morning.
Okay, okay. So hi everyone, I'm Dr. Sheila Nambiar. I'm an OBGYN and a lifestyle medicine physician, and today I'm talking to Dr. Aruna Nathan. Dr. Aruna is a board certified internal medicine physician and a lifestyle medicine physician practicing in Montgomery County, Maryland since 1998. In 2017, she became one of the first physicians in the country to be board certified in lifestyle medicine, a new specialty that uses evidence-based lifestyle therapeutic approaches to prevent, treat, and even reverse some of the diseases that are very prevalent in our society. While receiving her training at MedStar Union Memorial Hospital in Baltimore, she served as a chief resident in the Department of Medicine. She has won a number of awards for her work, and currently she has her own internal medicine practice where she focuses on primary care, serving patients from Maryland, DC, and Northern Virginia. She's been nominated by her patients and received the Patient's Choice Award and Compassionate Doctor recognition on multiple occasions. She's also listed in the Directory for America's Top Physicians by the Consumer Research Council of America and is included in the Directory for the Leading Physicians of the World International Association of Internists, listed as the top 10 internists by the American Registry and nominated and selected by her peers as a top doctor. This is amazing, Aruna. I think these kind of accolades are so much more exciting than from patients. I mean, it just, I think it goes to say what sort of a person you are. And I've seen that in our conversations that we've had over the months. Thank you so much for doing this. And the subject of today is immunity and how to improve immunity using lifestyle medicine. And you're a lifestyle medicine physician. Now, let's just start by saying, just give us a little bit about your background growing up. You did grow up in India and then you moved to the US. Am I right?
Yes, yes. So before I get started, I just want to say I didn't realize you would be, introducing me this way. Wanted to make sure this was more friendly, and I really
Oh, no, but I
appreciate
did,
it. But I'm
no, I
really
did want
humbled
to
by it.
say, yeah, I did want to say about the Patient's Choice Award. I was
Yes.
really impressed by that. That is really something I think one needs to be really proud of.
Thank you. Yes, Sheila, but I did grow up in India. I moved to the US after finishing medical school in India. And so a lot of my, my formative years and the thinking was molded growing up in India. When I grew up, when I was young, I had a good influence from my grandmother because my mom worked when I was growing up. So until I was about 6 years or 7 years old, I was mainly with my grandma, and so a lot of influence from her, and then my mom, also very strong women, and I think all of this kind of shaped me towards, slowly shaped me towards lifestyle medicine from a very young age. And I probably didn't realize all of this growing up. And so that's how I think of it. But
Yeah.
I did have, yeah, go ahead.
I remember a story you told me about how you used to train, go to the gym, take a bus, take public transport, and it was not the done thing in those days.
Yeah,
And when you were telling me that, I was thinking we must have been twins because I did I did the exact same thing when I was in Manipal, going to the gym where there were not many women in
yeah,
those days. I'm talking about in the early 90s.
yes,
Lifting weights and things like that was not the norm for women.
yeah,
So I think, like you said, the upbringing, who you're influenced by, strong parenting, and then having working women as mothers also
yeah.
has a very different kind of influence on us growing up. So you
Yes.
moved to America and then how did you get interested in lifestyle medicine?
My original plan was to actually be more, I'm an internal medicine physician. I trained to be an internal medicine physician. I love the science, of integrating everything in internal medicine. We look at all different systems. And my plan was originally to be more of a intensive care physician. So I was geared towards doing ICU intensive care, more of inpatient medicine. Um, I really never saw myself even as an outpatient medicine doctor.
Yeah,
But as I was doing more of inpatient initially when I started practicing, I missed the continuity of care. I missed the fact that I wouldn't see the patient again. I wouldn't, because you get to build a relationship, even if it's for a brief period of time. And that was important for me. And I realized that, and that's when I started seeing more patients as outpatients. And even the importance of prevention kind of is acute when you see it in the hospital. When, for example, when you see patients coming in with asthma exacerbations, and you know that they could have taken steps ahead of time, just to
yeah,
use asthma as an example. And then that's when I realized the power of being an outpatient physician. And over the years, we take care of so many things as outpatient doctors compared to uh, being inpatient. We used to always admit patients with pneumonia in the late 1980s and 90s, and now this is handled as an outpatient, just to give an
outpatient.
example.
Yeah,
And so how did I get into lifestyle? So as an outpatient medicine doctor, you start you start observing things about your patients a lot more. You have learned from your personal experiences and from family and friends about the importance of physical activity, the importance of eating right, importance of certain foods, importance of sleep. And so all of this was always in the back of my mind, and it would always it would influence how I would uh, have a conversation with
yeah,
my patients.
yeah.
But I never knew of it as as
That's a field
lifestyle
by
medicine,
itself. Yeah,
right?
yeah,
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 so when I heard of lifestyle medicine for the first
yeah,
time, I went for their conference in 2016. And
yeah.
I realized that there was actually
Exciting,
a
was it?
college. And
Yeah,
and so now all of these little studies that we have on sleep, on nutrition, they are smaller studies. They may be larger studies, but they are not exactly controlled trials. But all of this, now they're trying to make sense of it, and so we can use these as prescriptions. So just like I would prescribe a medication for blood pressure, I could now prescribe an actual change. For example, walking for 30 minutes 3 days
yeah,
a week, or making it a little more attainable, a little more specific for the patients to follow.
yeah.
And these are all evidence based recommendations.
Yeah, yeah. Isn't it exciting though that you can prescribe these things now? I mean, it's been known for centuries, obviously, but it's actually come down to a science where we can actually write a prescription and say you need to do this much for you to achieve this goal. So that makes it so much more effective for the patient, and also, so I think it's more it's goal oriented, so the patient also knows what to do rather than just telling her, go and lose weight. So how does she do it? Then she runs around trying to find various ways to lose weight. But if you're able to give her the right kind of advice with the exact prescription, then there is a goal. And there are steps towards that goal, which is what makes it so exciting, isn't it?
Yeah, yeah, absolutely. One
Yeah,
of the when you start with lifestyle medicine initially, you're exposed to a lot of different aspects. But one that really I think I use a lot of now, and what really helps me is you really get to know the individuals and your patient, and then you form a partnership with them, right? So you're both a partner in terms of a coach, and also you're a you do have expertise in your field, and so you kind of go back and forth between being a coach and a patient.
sorry.
And you can really make recommendations based on their eagerness to change. So you can give them very specific directions, and they can come up with specific plans themselves. And
Yes,
sometimes when patients are not ready to make a change, you can just float an idea, and and try to see when they may be ready to make a change. Sometimes they may want to lose weight by making changes in their diet, but they may not be ready to address some of the
right.
other issues like sleep or
Yeah,
physical activity. So it kind of helps form those, the
relation.
stronger patient physician relationships.
Yeah.
And I think that's where it's a big that's a big difference compared to just practicing
Yes.
traditional internal
Yes.
medicine.
And there's so much more of involvement, or rather, we would like the involvement from the family as well, isn't it, as lifestyle medicine physicians? Because the patient is not an individual, is not living in a vacuum and giving her instructions to do this and that or change her diet. It doesn't happen in a vacuum. She has to take into consideration everybody else. And especially in a country like India, Aruna, just for, I mean, I'm sure you know this, mostly the women cook for the
Yeah,
family, and if she has to cook separately for herself, it becomes a huge issue. And sometimes they're working, so which means if she's cooking three different kinds of food for her in-laws and her husband and her children and for herself, it becomes really difficult. So knowing that, and involving the family and telling them that this has to be a combined effort and getting them involved as well is really does make such a difference. And you're right, it's more like a coach rather than a doctor just telling somebody to do something. There's a bit of hand holding there, and that makes it so much more interesting. I mean, I enjoy that as
yeah.
well. Yeah.
No, and what you said, yeah, it's very true. And it is not, it's the same for the people in this country, the same for the women here. I think one of the most difficult things is to, like you said, having different foods for different people,
Yeah. Yeah.
and then coming up with some simple solutions for that. And those are the kinds of things we do. And even for example, is like how, we are right now we are thinking of some kind of a weight loss program, but I don't like the term weight loss because I
Yeah.
really think of weight loss as a side effect. But one
Yes.
of the
Yeah.
biggest components in that is how to make it practical so
Mhm.
it's not an added burden for the person who's trying to lose weight and trying to eat differently, and
Yeah.
to see how we can incorporate some simple solutions so everybody is aligned. And the other way, the family and it's the whole community and all of that also affects an individual is,
Yeah.
it's just just the power of advertising or false advertising,
Yeah.
or things that are considered healthy or things that are considered normal, uh,
Yeah.
you know
Yeah.
are many a times not very helpful for an
Yeah.
individual or for their health.
Yeah. And the fact that society accepts it so easily. Even the amount of food that's eaten, the amount of food that's served is accepted. So, a person gaining weight or getting unhealthy is really not just an individual problem. It is a problem of the entire society, isn't it? While of course one should take responsibility for oneself, there's so much of societal pressure that comes into it, and keeping that in mind, I think helps us also deal better with and be more compassionate
Yeah,
basically with
yeah.
the patient or the client or the person, isn't it?
Yeah, absolutely. It's like almost swimming against the current, for that individual,
Yeah.
when they want to make a change, or sometimes, they don't want to do it because they think they cannot do it. They just
Yeah.
believe that it's
Yeah.
impossible,
Yeah.
and they accept it. And so it's one of the first things I think that would be good to hear when you see a physician is, it's not the patient's or a physician letting the patient know it's not their fault that they're overweight. It's not their fault, and it's because there's a lot more to it than just individual decision.
Absolutely. Absolutely. So going into immunity, which is the main area that we wanted to discuss today, Aruna. Now that with COVID and the pandemic and all of that, why is there this emphasis on weight and weight having this negative effect on the severity of symptoms, on the mortality rates, etc. Why do you think that is? Could you explain to our
Sure.
viewers?
Sure. So what we have seen over the past, almost a year now with COVID is that people who are obese or overweight are not only at increased risk of contracting COVID or acquiring the infection, but they're also at increased risk for more severe disease or more complications. In fact, one of the studies showed that hospitalization increases almost threefold in
Yeah,
patients who are obese or and so this is a big concern because many people are overweight and many people are obese.
yeah,
And why could this be? It may have to do with immunity, mostly has to do with immunity.
yeah,
And also, so and we've seen that in other conditions, in the past. We've also seen with response to certain vaccines, people who are overweight may not respond as well. And so it has definitely got to do with immunity. And
mm,
it also may have to do with lung functions. And, obesity does affect
yeah.
our lung capacity. And so that may also be another reason.
Reason for it, yeah. So, can you explain a little bit about the immune system so people understand it?
Sure, sure. So the immune system, when you think of the immune system, think of it as a system. So it's an interplay of multiple different small systems, and it has to be in harmony. So what the immune system does for us is it prevents infections. So it prevents infections. It fights against things that are not normal or not known to the body, that are foreign.
Current.
So think of it as if there's a foreign substance like a virus or a bacteria that comes in contact with us. So then there's a change in the, that's a different cell. So our immune system perceives that as something foreign. That substance may secrete a substance that our body might recognize that as a signal. And so then there's a interplay of cells which are in the blood in our blood, and there are different organs like in the bone marrow, in the spleen, in the thymus. And these different systems have to work together to defend us. And so if we don't have good immunity, or if these systems don't function, they underfunction. So
Yeah.
you can have lack of immunity, and that's what we call immunosuppressed or low immunity. But there's also a problem when this immune system does get activated, but then it doesn't stop. So an overactivation is
Mm.
also a problem. That's what we see in allergies, or with autoimmune conditions. So it's almost like this system has to function in harmony. It stops and starts and starts the pathways and the cascades down
Yeah.
the system in a controlled manner.
Yeah. So they do. So this system sends out cells to the place that is, let's say there's an injury, it sends cells there, almost like going to battle, and protects that area, cordons it off, perhaps if it's an injury. So it's almost like it's protecting us against any kind of not just injury but infection, any threat,
Yeah,
basically,
yeah,
isn't it? So
yeah.
yeah, what you're saying is that it has to be balanced. It shouldn't be too much when it goes into allergies and autoimmunity, and it shouldn't be too little where you can, your chances of getting an infection, getting anything from any kind of disease is increased. Yeah.
Yes,
So
yes,
so
exactly.
how can you? What are the things that one can do from a lifestyle perspective? What can we do as people, as individuals, to improve this immunity?
Sure. So, one of the things when we talk of immunity, right? When we people use that, um, almost like they think there's a fix to it, in terms of taking a pill.
Hell yeah.
And when you walk into a drugstore, or you just turn on your laptop or your TV,
Yeah.
You'll see lots of ads for things that can boost your immunity.
Yeah.
And and so I think that is just, um, I'm at loss for words when it comes to that. But you think of what can you do for your immunity? It's not a simple solution, just like it's, a complex system. What can you do for your immunity is you can eat better, you can sleep better, you can be physically active, you can, stress better, or you don't stress as much.
Yeah.
And so these are all the different things that you have to do together uh, to help to maximize how well you do with your
Optimize.
immunity.
Yeah.
So, from the lifestyle point of view, the most important thing we can do is making sure we make good food choices.
Yeah.
And but that alone is not going to be enough. We have to make sure that we are respecting our sleep, making
Yeah.
sure we sleep well, we rest well, we have good amount of physical activity, because all of these are actually linked to immunity, and
Yeah.
now we are even have studies to show that there is evidence to that.
Yeah, yeah. So if you can you what is this? What is oxidative stress? There is this whole concept of, if there is oxidative stress, then you have free radicals, and that reduces
Yeah.
immunity. So what is oxidative stress?
Sure. So, so the first time that term oxidative stress was first, it was in the late 80s to early 90s is when
Mm.
people started talking about oxidative stress. And so in the body, we are constantly producing and destroying cells, the constant reactions taking place in different cells in the body. And we do produce we do produce oxidative stress as a normal process,
Yeah,
but we have processes in place in the body to get rid of these stressors. So they are usually substances which are able to they are electron grabbers. So they lack one pair of electrons, so they take that electron from some other molecule.
mhm,
And so they can change structures in the DNA, in proteins, in lipids. But it's not abnormal to have it. You do have it to some extent.
mhm.
In fact, you do need it sometimes, like when you exercise, there's oxidative stress, and then it helps modulate the muscles better.
Yeah,
So it's not a bad thing. It's almost in the body, if everything is in homeostasis or calm, this oxidative stress, it's almost like there is a system which will quench it, just like when there's fire and you throw water on it, right? But when there's buildup of more oxidative stress, or there's buildup of more of these free radicals, as we call it, there can be more damage done, which is not reversible in the cell.
mm,
So initially, when it was studied, it was mainly studied on atherosclerotic blood vessels and the blood vessel lining. But it really affects every cell in the body. And it's also the process of aging to some extent.
yeah,
And so it's almost, think of it as a seesaw. So you have things that are oxidative and those that are antioxidants.
yeah,
And so you have to keeping it in balance. The best balance is will help with many processes. It's linked with atherosclerosis, with diabetes, with cancers, with aging itself, immunity.
yeah.
And
So, and do you have, there are supplements like with antioxidants. How much does that help? Is there science behind, antioxidants?
I think that I love that question because it just opens up so much to discuss. So, so there are studies that have shown that when you eat a diet that is rich in vegetables, lentils, beans, fruits, seeds, all
Yeah,
of that, these are very longitudinal, more like population-based studies, and they've shown that this definitely helps with decreasing oxidative stress. But when they try to kind of take the substances out, right? So they studied just, say, vitamin C,
mm,
or they studied just beta carotenes,
mm,
or they studied vitamin E by itself. those studies didn't show any good results. So vitamin E, when it was studied for heart health, did not have any results. When they studied beta carotene in patients with lung cancer, it actually showed a negative effect.
Mm,
So and for example, if you take, say, cup of strawberries, the cup of strawberries will have just maybe 81 or so milligrams of vitamin C. But when you take vitamin C by itself as a tablet, you can get up to 500 milligrams. But the vitamin C that's in the strawberries is along with some of the other phytonutrients in the
yes.
strawberries, like flavonoids. And when that works together, it seems to be more protective than just taking the supplement like vitamin C by itself.
Yeah.
Plus, they've also shown that when you take these like, say, for example, vitamin K, if you were to just take vitamin K as a supplement or in a tablet, it's just one form of vitamin K. But if you eat foods that are high in vitamin K, you get maybe 8 different types of vitamin K, which is what,
Yeah.
we are more programmed to receive in a way, right? In your
And
from your
better
gut.
absorbed, probably, isn't it? Better
Yes, yeah, yeah,
if
yeah,
it's from natural foods. Yeah. So
yeah,
while, I mean, I think many people, many, they want to take something to improve their immunity. And while it may be prudent to take a supplement, a multivitamin as a supplement, but that is not sufficient, isn't it? That is not, you can't take a supplement and think that you are making up for a poor diet. A diet that is deplete of what you said, the fruits, the vegetables, the beans, etc. So,
yeah.
and I know many people who'd say, I'd rather take a vitamin, but it doesn't work like that, isn't it?
It No, it doesn't work like that. And also, I think that people, especially times like now with COVID, when there's word of immunity all over the place, and people actually buy things which may cost a lot and do nothing for them, and
Yeah.
sometimes may be harmful.
Just expensive urine. That's it.
Yeah,
Yeah.
yeah, yeah. And so it's really really important to state that it's not in the supplements, it's all in the food and how you eat it. Yes,
Yeah.
sometimes you may need to supplement
Yeah.
with a multivitamin like you said, but we definitely don't want to do it in mega doses.
Yeah, yeah. And one of the ways to ensure that you get there are so many multivitamins, micronutrients, etc., is, I always say eat all the colors, so you're not worried about, okay, carrot has vitamin A and this, you don't need to worry about that really. If
Yeah,
you choose the different colors and then vary your vegetables and your fruits through the week, you don't have to have everything in one day, but through the week. And isn't it also true that it's really the composite of your diet, not just what you eat in one meal or one day. It's a combination of what you would eat consistently through the weeks and through the months that really impacts your health, isn't it? See, one bad meal or one indulgence really won't make too much of a difference, isn't it? And you'd rather stay consistent with a good diet than beat yourself up for one indulgence or one bad meal.
absolutely, absolutely. I think I love what you said about eating the rainbow, making sure that you're getting all the colors, because that's where all the carotenoids and all the phytonutrients are all in the colors. So having
Yeah,
different colored vegetables
yeah,
and greens,
yeah, breathe,
and then
yeah,
rotating it through the week, so you're getting, we only know a fraction of what the nutritional science. There's so much to it.
yeah,
And eating food as food, not as a macronutrient, right? We don't want to break, we think of food now as a math equation, right? It's
yeah,
not, it's not really that. You can think of it as a math equation maybe for taste, you want all the different tastes, and that's how
yeah,
chefs think, which is cool, but not for, like, it's like protein, high protein diet, high
yeah,
carbohydrate, or
yeah,
low fat and high
yeah,
fat.
yeah,
And that's not what food is meant to be.
yeah,
But um, but i and um, it's absolutely what you said is right, is making sure that you're consistent with, and always small. When you're making a change, just start with a small change, right?
yeah,
um, and if you just start with a small change and stick with it, it
yeah,
does you more good than doing something drastic for 2 weeks and then you
true,
realize you can't keep up with it.
yeah,
And then and then you feel bad
Yeah.
about eating badly.
You just, yeah,
And
yeah. You just
and
slide right back. In fact, you may go further back because there's the shame and there's the guilt, and
yeah,
you feel you've let yourself down. You feel you've let your doctor down. A lot of the time, that is what I find happens with people who go on diets. And although I keep telling them, look, it's not about the result; it's about the process, right? The process is important. So you don't have to go from 1 to 10 overnight, because and you can't sustain that. Change is difficult. You can't sustain it. So many who try and who are really enthusiastic and they try everything at the same time, and then they sustain it maybe for a week, and then they can't, and then there is the guilt, and then they just go fall right off the wagon. And very often they don't come back. They don't contact me because they're feeling guilty. And I have to say, and when they do, after a while, I have to say, look, it really doesn't matter. Nobody's judging you, isn't it? It's a process of change. And the fact that you want to do it itself is something that's highly commendable, isn't
yes,
it? So, because I really think food and changing food habits is really, really hard. It's
yes,
really hard, because you're programmed to eat in a certain way, especially if it starts from childhood. And it's really hard to change that. If you're trying, that itself is a huge step forward.
absolutely.
Yeah.
One of the things you touched on, about making small changes in the diet. I think one thing that comes to mind is a study that was published in Annals of Internal Medicine, and the
Mhm.
only change they made in this group, and it was a pretty large study. The only change they made was increasing fiber intake. So
Mhm.
they just had the people eat foods high in fiber,
Right.
and about 30 grams a day, and
Yeah.
everything else stayed the same. And they
Yeah.
compared it with a group of patients that they gave a much more stricter diet, a lot more calorie restriction, and specific diet. And the group that had a higher fiber intake lost significantly more weight. In
Mhm.
fact, by increasing your fiber intake, you can actually, you know, uh, you say by about 25 to 30 grams a day, which is not that
Yeah.
much.
Yeah.
Over the year, people lose up to 13, anywhere from 9 to 13 pounds just by doing that.
Just
And
fine. Yeah.
yeah,
Yeah.
and so it's and another thing I wanted to point out when you also said is when we feel the guilt, right? I mean, it happens to everybody. It happens to me. It happens to
Yeah.
anybody. When you eat certain foods, you're like, oh my goodness, I ate, like, I'm not supposed to eat this, and you're
Yeah.
still eating cookie, and
Yeah.
but you don't even enjoy it, and then you feel bad afterwards. So what I started doing myself, and I'm telling my patients is, when you feel that way, just
Yeah.
instead of taking a small amount and then going, you take a small amount of ice cream and then you go back and take a little bit more. Instead of that, just take what you want, sit down, completely
Enjoy.
enjoy the movement, enjoy that moment when you're eating and the taste. So that way, you don't feel too bad about it.
Guilty.
You
Yeah.
acknowledge that you wanted something and you had it. And um, you really the other thing is about not wanting to see their physician
Yeah.
because they haven't really lost weight. And I can tell you, I've been guilty of that myself. Um, a few years back, they would call my patients and then they would say, but I haven't really lost weight, so I want to do that before I see her. I'm like, no, that's exactly the opposite, right? And then I realized, what am I doing wrong to and so that's when I realized that it's not you don't really want perfection. You want to make
No.
small changes
Yeah.
and,
Exactly.
and encourage just small changes. And
Exactly. Yeah. Yeah. Talking about fiber, Aruna, can you tell us something about the importance of fiber for immunity?
yes, yes, of course. So there is definitely a lot of benefit eating fiber, right? So one
Yeah.
of them is, like we just talked about, the weight loss aspect of
Yeah.
it, because just by losing weight, you're going to have better
Yeah.
immunity,
Yeah.
right? Um, Fiber also when you have fiber consistently in your diet, there is low incidence of diabetes.
Yeah.
So that means that sugar is controlled better, which will also improve your immunity.
Yeah.
It also um, has, there are many useful. So the what happens when we eat fiber? It's we are we when so there's different types of fiber. There's soluble, insoluble, but let's not get into the details of that.
Yeah,
um, it like it can, so one part of it is just going through your gut and it goes into your colon. That's where most of the our microbiome live, and
yeah,
the fiber
yeah,
really is great for them. So when you eat foods high in fiber, you're actually changing the microbiome, you're actually boosting good microbiome, which again helps your immunity.
yeah.
So there
Those who
are,
don't know, the microbiome are the bacteria that live in your gut. So essentially, what you're saying is you want to feed them so that the colonies improve, better colonies that protect you.
yeah.
Yeah.
Yeah, and the good thing about this is that this is not something that we have to do for years to achieve. Uh,
Mm,
they have actually seen that the colonies change quite rapidly.
mhm.
So you can eat well for maybe a week, and there can be a change in your
Yeah,
colonies. But it also goes the other way around. If you change, then it
badly.
goes back to the
Yeah,
the other colony. You know, and
yeah,
and the more varied foods you eat, the more diverse the colonies, the more, different types, and that's what you really want.
yeah, yeah. And fiber is present in
In
vegetable. Yeah.
Yeah.
Most people, are not really aware of where fiber comes
Yeah,
from. So
yeah,
veggies, the fruits, the nuts, the seeds, beans,
yes.
they
Lentils,
do
beans, legumes, yes.
legumes.
and
Yeah,
and they've been really associated with good gut health and good immunity.
yeah,
um
yeah.
yeah.
And animal foods don't really have fiber, do they?
Yes, yes.
They're lower in
And
fiber and
yeah. And also with animal foods, like with red meat, there is association of choline, and it actually generates a byproduct from the gut bacteria, which
mm,
could be detrimental to our blood vessels and
health.
our
Yeah,
metabolism. TAMO is generated. So there are foods that can improve the gut bacteria, and there are foods that can, have been shown to
be detrimental.
worsen. Yeah, yeah.
Yeah, yeah.
Yeah.
So what about sleep? We just talked about that and how, like I can tell you from personal experience that 2 nights of sleep deprivation and my nose is leaking. And I know immediately that, my sleep has not been good. So sleep is definitely very much a part of a healthy immune system. And we're learning more and more about sleep. So can you tell us something about, how sleep affects our
Sure.
immunity?
So I think sleep is one of the best medicines that we have in our pockets. If we can develop good sleeping habits, and I really think that it has to be something that we have to work. It's best to try to emphasize this to our children,
Mhm.
even though it's really difficult at that age for young people to understand the importance of sleep, because
Yeah, with
you
all
can
the
get away with
distraction.
a lot when you're young. You
Yeah,
can get away with a lot but as you grow older,
yeah,
you're going to have more trouble if you don't sleep, if you don't get a good night's sleep. And it's
yeah.
quite obvious. You can pretty much go for one night with less sleep, or second night, but by second night you start feeling the effects. In fact, they've shown that people who have it on a chronic basis, they don't realize that they really have sleep deprivation, because they think that's how they normally feel.
Feel, yeah, yeah,
um, and
yeah.
so if in fact you go for like 15 days or so with sleep deprivation, it's almost akin to having some amount of blood alcohol level. you
Mm,
know
yeah,
that's how
yeah,
people function with lack of sleep.
yeah. With,
And when you sleep, there are many protective um, hormones and neurochemicals that are secreted. One of them are cytokines, which you need in large amounts to fight against bacteria and viruses. You need cytokines for immunity.
yeah,
So there's a direct correlation. When you sleep less, there is less cytokines and there's less
yeah.
immunity. Um,
And
that's just
trust.
looking at it very simplifying it. But and sleep also affects your microbiome.
Yeah,
So there's a lot. All of these things are interconnected.
absolutely, absolutely. Yeah,
Sleep increases stress.
yeah, yeah,
Lack of sleep, I mean, in decreased sleep increases stress.
yeah,
Lack of sleep also increases propensity to gain weight
Yeah.
and then you have chronic inflammation,
Yeah.
and and the chronic inflammation aspect of it is again going to affect your immunity.
Yeah. 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 It's interesting, isn't it, when we see that all these systems are so interrelated, as you said, and when we start looking at them all separately, your gastrointestinal system separately, your cardiovascular health separately, they're all so interconnected, as is the immune system, which is so closely interrelated with everything else. And you mentioned stress. How does stress also obviously affects our immunity, and really, really badly. So when you are, stressed chronically, it's not about those, obviously all of us have stress, and, your life is all about managing that stress. But when it's mismanaged or badly managed, and when you have chronic underlying stress, that's when the problem happens. And we all see that, isn't it? When you're very stressed out for long periods of time, you're catching colds, you're falling ill, every virus that passes by, you've got it.
Yeah.
So yeah, so
No,
it,
I think, yeah. No, stress is a big player, you know,
yeah,
especially in today's world, right? Stress is it has touched mostly everybody,
yeah,
and so like you said, the fight or flight or the acute stresses, they are good for you
yeah,
because they actually help you deal with a situation. And it it definitely helps in short term. That's what studies show.
yeah,
But the type of stress that is bothersome is the chronic stress, right? It's the stress that you feel when you're doing something and you think about, oh, I should be doing those three other things, and when am I going to catch on to, get on to doing this, or I didn't take care of something yesterday, or
yeah,
these are like little stresses that add up, and then you get into this, it kind of tips you over into a more chronic sympathetic overdrive, as
yeah,
they call it. So the stress hormones that generally peak and come down don't do so. They stay up at
stay,
at this higher level,
yeah,
and it prevents the body from taking care of some of the important functions like healing.
yeah.
We are constantly in this cell cycle
Housekeeping,
of healing,
yeah,
and
yeah,
so it prevents that, and it definitely um, um, you're much more prone to infections because it affects immunity
yeah.
directly.
And even
And
during this pandemic, Aruna, I think half of the stress is the fear of the pandemic and the fear of getting it, and the helplessness. And then, of course, the isolation and all of that. All of that is added to the actual infection and the actual incidence of the infection, isn't it? Um,
absolutely. I think that what you mentioned, loneliness is one of the biggest issues right now.
yeah,
We already, at least in the US, loneliness it's a pandemic by itself.
yeah.
And then you have COVID now, where you really have to maintain
Yeah,
social
social
distancing,
distancing. Yeah,
and which is the most important thing. What can you do for not getting an infection is not being exposed as much as possible.
yeah, yeah,
And so loneliness, it has effects. So people who are lonely are more prone to infection, and then people who have infections, not just COVID, any kind of
mm,
chronic state, are also prone to be lonely. And
yeah,
they've shown this, it affects the centers of the brain. So chronic stresses, chronic inflammation, chronic diseases have
yeah,
shown to affect centers of the brain, which
yeah.
will then have the patient feel more lonely, or people feel more lonely. And there's
Mm,
actually alterations in the genes that have been shown
mm,
that occur through loneliness.
yeah.
And
So one of the other aspects that affect immunity is, of course, exercise.
right.
And we do know that the optimum amount of exercise is what is important, right? So how would you have you been exercising regularly through the pandemic? Have
So
you?
yeah, I think for me to be, I almost feel like I've come to a point where I have to exercise some to function. So it's become part
Yeah,
of I've built my day around it.
yeah,
It has been difficult during the pandemic. I think initially, when the beginning of the pandemic, everyone kind of got into this almost a warrior mode. So I
mm,
was more like, I need to exercise because I know if I don't exercise, I'm
Yeah.
not going to be able to do any of these things. So
Yeah.
exercise was a big chunk of my in my mornings.
Yeah.
But as it went on, maybe I slipped a little bit in my exercise. I
Yeah.
did more walking outside, but then I've, in the last month or so, again restarted it. But I do believe that, everyone's going to go through some kind of peaks and valleys. Some people are a lot more consistent. I think, Dr. Nambiar, you're probably a lot more consistent with exercise.
Like you
And
said, like you said, I think it's become so much a part of my life that I don't even consider it as something that I have to do. You just do it. And I think one of the things that one needs to be conscious of is there is a sweet spot where too much of exercise, like really running marathons and running a huge number of miles in a week, can be detrimental to the immune system. And at the
yes,
other end of the spectrum, not exercising at all can also be detrimental. So you need to have that balance between doing too much and doing too little. And of course, what you do matters, isn't it? Doing only cardio, while I love cardio, but I have to literally tell myself that I need to balance it out using strength training and using yoga. And I love yoga too. So there has to be a balance of all the pillars of fitness, so to speak. And of course, the intensity is important.
yeah,
Moderate intensity is what is, advisable. Long duration of high intensity is really not recommended for immunity. I'm talking about.
yes, yes,
So,
yes, yeah,
so yeah, long duration of high intensity is not recommended, whereas shorter durations of high intensity interval training is fine. It
yeah,
seems to improve one's immunity. So I think all this needs to be kept in mind. And for me personally, I have to actually check myself from doing too much because I tend to use exercise as a solution for everything. So I have to tell myself, you need to back off a little bit. And
yeah,
so all of us have our Achilles heel. So yeah.
yeah.
So any other thoughts? Do you? Oh yeah, I had one question. Does eating less improve your immunity?
Immunity. That's a great question. But I just wanted to say a few things on exercise before
Yeah,
we get there.
sure, sure.
One of the things, yes, when I usually advise my patients with exercise, I really ask them to start very low and go slow,
No, yeah,
right?
yeah,
Because
yeah.
we definitely don't want injuries, and
Absolutely.
it's very easy to get caught up in the moment and kind of push yourself, and then have
Yeah,
to deal with an injury which might set you back a few weeks or months at a time.
absolutely.
Especially big injuries, like like if you have shoulder
Absolutely.
pains, and it can really complicate your healing
Yeah,
process, right?
yeah,
And so, and then always safety first. So if they're going to start a program, making sure that everything is safe in their environment, and especially after a certain age, you want to really prevent falls
yeah,
at time.
yeah,
So,
yeah.
and I really like the concept of an exercise prescription.
Mhm.
And I wish I could do that almost with every patient every time I see them. Is to actually give them a prescription for exercise, just like you would for any medication,
Yeah,
and make it, like you said, very specific.
yeah,
Um, and your work, you're targeting the cardiovascular aspect of it, you're
yeah,
targeting the weight bearing aspect of it, the
yeah.
flexibility, and also balance, because all of these things are, if you don't use it, we definitely lose it,
Use it.
right?
Yeah, yeah,
And the good thing about exercise, it's so, we always we lose bone, right? We lose our bones mineral density as we age, right? So if once we are in our 30s, it's a slow decline, right? But and we can't do too much about it, but we can do a lot about the muscles. We
yes.
can prevent muscle loss, and this can be done even at age 90 plus,
Yeah,
right? And
yeah,
so when you can think of it that way, that you can actually change your muscle mass, or
yeah,
your strength with
yeah.
exercise, that's huge, and it definitely will protect even your bones.
Absolutely.
So I just wanted to state that, because I feel like that is so key to understand where, the from all the things that we have discussed, the foods, the sleep, the stress reduction, all of that. We, the one of the biggest things that I think that is easiest to adopt is physical activity.
Yeah.
So
Yeah.
I always like to start with that because it gives you immediate pleasure, you
Yeah.
know,
It also
you know,
improves your
right?
mood, doesn't it?
Mood, right? Yeah, yeah. So when you feel that, that's like a driving force to
Absolutely.
start with physical activity. So you feel good, then you are also able to make better choices with your
Yeah.
foods, you know, because
Absolutely.
you're feeling better.
Yeah.
So
Yeah.
and then to address the thing about eating less, or did you mean something like calorie deprivation,
Well, yeah,
and
eating less or even time restricted feeding.
time
Uh,
yeah,
yeah.
yeah. So
I
there
mean,
is more.
let me put it like this: does overeating affect immunity? Let me
Yes,
put it like, yeah,
definitely the answer is simple to that one. Overeating will affect immunity
yeah,
because when you overeat, you are going to have weight gain, of course, but also you're going to have things like more oxidative stress, right?
yeah,
And so definitely overeating will cause. But when we undereat, there are some studies now that are showing that when we are slightly calorie restricting,
mm,
and also eat that, I'm not sure about the time, but more to do with calorie restriction,
mm,
there
mm,
may be less oxidative stress, there may be improved immunity, there may be
mm,
increased longevity.
mm.
But again, all of these things are, they come with caveats, because you definitely don't want to lack the nutrients that you're supposed to. You're
Nutrients.
supposed to eat a well balanced diet.
Yeah,
Um, but definitely there's a
it
lot more
has to be
science.
done under guidance. Basically, that's what you're saying.
Yes, yes.
You
And
can't
but and
just
there's
go and cut out your calories and start, you know.
exactly, exactly. But when done under guidance, there is more and more evidence that it is not only good for your immunity, it's good for your overall health.
Yeah,
You're really improving your health span, as to say.
yeah.
Um, but it has to be done correctly because it is a very new science.
Yeah, yeah. Even just going back a little bit to exercise, I really think it that also needs to be done under guidance because something simple like walking is fine, but even how much to walk, the speed, the intensity, all of that, unless you are given a goal, it's very difficult to actually make a change. And as far as strength training and flexibility goes, certainly you do need to do it under guidance, especially for the first maybe 6 months, so that you learn the exercises. And like you said, the most important thing should be safety.
Yeah,
You don't want to injure your shoulder and then not be able to lift it. You don't want to
yeah,
have a back problem and then not be able to do anything at all. Forget the exercise but not be completely laid up. So under guidance becomes really important. I think I think people with in their enthusiasm, they like to go and join the latest fad, like, and then you're not really fit to do that.
yeah,
Like for instance, they start playing a game like tennis or badminton. It's Those games are not really to lose weight. You got to be fit to play the game.
mhm,
So injury is so much higher because of the lateral movement and the sudden movement, sudden changes in direction, etc. So a lot of the time, especially for those who are not athletic or who have not trained, it's better to start really slow, start with something really simple, get into the rhythm. And like you said, it improves your mood, and then you start to want to do other things.
mhm,
And then you start to include strength and you start to include flexibility. Then you can, explore and experiment and, join any class or start playing a game, etc., etc.
yeah,
Because I see injuries so much, and it frustrates me that somebody is doing so well and then they just get injured and
yeah,
they're set back, you know
yeah.
so yeah, I think that's something that needs to be kept in mind. So any other thoughts, Aruna? We've been talking and talking. I'm just
Yeah.
going to check Facebook to see if there are questions, any
Sure.
questions that not able to see the comments. If you have any other thoughts on
I think one of the things we did not probably address is, we talked about in general, but I think
Mm,
specifically stress reduction, like what can we do? We can't really reduce the external stressors, but what
mm,
can we do ourselves to kind of help with shifting that state from a more sympathetic overdrive state in our minds to a more parasympathetic state, right?
Mm-hmm.
So,
Mm-hmm.
so I think if
Rest.
you've approached it from the bottom up, with exercise, and so what's easiest is, you exercise, you can control your body, you can't control your mind, and then
Yeah.
that will, there's body and mind is connected, and so that will kind of calm the mind and increase the parasympathetic state, right? And
Yeah.
the other way is to do it from up down, right? So that's more of mindfulness training.
Yeah.
And there's a lot of science now, a lot of evidence from various studies, and we do have good recommendations, and how mindfulness is helping with
Helpful. Yeah.
uh,
To
with
improve. Yeah.
immunity, yeah. And there's a direct
It's
correlation with
basically it
immunity.
reduces stress, doesn't it? I mean,
Yes,
that's
yes.
what it does. Yeah.
Yeah, so it kind of helps us modulate, or how we deal with stress.
Yeah.
um, and so so I think that is also something that I like to emphasize.
Yeah.
uh, and there are simple things like just breathing techniques, and it can be done really you don't need a lot of time to do it.
Yeah.
It's you can do it any time of the day, so
Yeah.
those are the kinds of
Yeah.
things.
Just a few minutes is sufficient. Yeah. Yeah.
Yeah, yeah.
There's a question here, Aruna. It says, if one can eat less salt in the food, does it help immunity?
Uh,
Otherwise, is it also good to adopt? He wants to know.
Yeah, so I think in general, we do consume a lot of salt, and many times we don't even know that we are eating salt.
Too
So,
much salt.
foods
Yeah.
like breads may have salt, a lot of the sweets that you buy from baked goods may have salt.
Yeah.
So, in general, I think it's good to kind of know how much salt is in your food.
Yeah.
I can tell you in the US, on an average, people consume about 3,800 or so milligrams of salt or more per day. And the American Heart Association guidelines for patients with hypertension is about not more than 1,500 milligrams.
Yeah.
But if you were to cook at home, you can actually get away by eating less than 1,000 milligrams of salt. So, yeah,
Yeah.
definitely good. And you can find a lot of resources of this if on the American Heart Association, the CDC.
Yeah.
Yeah.
Uh, I think you addressed this about immunity. Does intermittent fasting build immunity? You'd already addressed that. And Angela says, great conversation, you guys. And Mahima says, love what you said about treating food as a math equation. It's more than just protein, carb, and fat. Yeah. Can you elaborate on muscle mass and how to increase? Yeah, well, resistance training is the way to go, which means that you need to add challenge to the muscle, and that can be with with either your own body weight or using dumbbells, using the machines, using barbells, anything that challenges the muscle. So you see, in today's world, we don't challenge the muscles that much. We don't do anything physical that puts stress on the muscle. And the way to do it is in the current day and age is to actually use external resistance in the form of dumbbells, barbells, machines, and so on, and perform specific exercises that address specific muscles in order for them to grow both in strength and in size. Vinu Sharma says, I hope that answers your question, Lakshmi. Great session. Yeah. So that's it for the questions, I think, Aruna. I think we've gone way past our time as usual,
Oh,
chatting. And it's been, yeah. So we've been chatting and chatting, and I think we could go on and on because it's such an interesting topic. And what I hope to do with these conversations is to empower people to take health into their own hands, because there are so many little things that they can do, on their own, which will can improve their health vastly. You don't need to wait for a disease. You don't need to wait for something to happen to run to a doctor, isn't it? So that's where lifestyle medicine plays such an important role. And I think I think it's a future of
yeah. I can't. I really think that not incorporating lifestyle medicine into a practice is it's
Detrimental,
It's
really.
detrimental. You
Yeah.
and I think like you said, you start with lifestyle as a foundation,
Yeah.
and then you use it at every stage. So a patient who needs to be on medications can still use lifestyle
Of
medicine at
course.
every stage,
Yeah. Yeah.
and
It's
yeah,
complementary to allopathic medicine. It's not that it's an alternative. It's complementary, and like you said, if you're a diabetic, you continue to use the medication, introduce lifestyle, and then you may be able to cut back on your diabetic drugs or your hypertensive drugs. So it is definitely something that I think patients, the layperson needs to look at as a way to stay healthy and to prevent illness, and take health into their own hands, basically, isn't it? And it's such an empowering feeling. Yeah. And just to
absolutely.
go back to where we started about your upbringing, growing up, and we did talk about this a lot. And I think a lot of it has to do with, you were telling me about your mother being a working woman, and you having to, what you've learned and what you are today is a lot to do with the influences that you've had. And your mom you said she did things differently, and yeah, I think she
Yeah.
started you learning yoga, you were telling me.
Yes, yeah, yeah.
Yeah.
So that's why we were influenced by that, me and my brother, and
Yeah.
so that was great because I got to learn yoga one on one, and the person who was teaching yoga was actually an MD himself, and
Yeah.
so
Yeah. Yeah.
and so
That's
you get to
wonderful.
see how everything kind of should intertwine, and you work together. So to me, I don't see lifestyle as not. I think of lifestyle as just medicine, right?
uh,
And
yeah. Yeah.
right, and so I think it has to be part and parcel of of everything in medicine.
Yeah.
And I like what you said. It's like it really empowers an individual
Yeah.
because you don't have to depend on something external
Yeah.
to influence your health. You're taking it, you're doing something by yourself and letting your body heal itself, which
Yeah.
is amazing.
Yeah.
um, which doesn't take away from the fact that you may need medications.
Of
uh,
course. Of course. Yeah.
Definitely will need that at some point. Some people need it for sure, but
Yeah.
you don't need too much of it. You could use
Yes.
maybe a little less and have fewer side effects.
Yeah, yeah. Now, why I brought up your upbringing and the background that you spoke about is that for people like you and me, for instance, it may be easier to implement these lifestyle changes because it was a part of our life. It's
Yeah,
not that easy for everybody, and I get that completely, but it's not impossible, and the steps can be very, very small. Like you said, start small and then grow. It's not impossible. The thing is that there are such amazing benefits that there's just absolutely no reason why we shouldn't try it.
yeah, absolutely,
Absolutely.
absolutely.
Yeah.
There's
So yeah. So
nothing to lose. Nothing to lose.
nothing to lose. Exactly. There's absolutely no side effect. No side
Yeah,
effect. Unless you're foolish and go running
only
and do something
only the good. You'll only have the good side effects.
positive effects.
When yeah,
So, yeah, thank you so much, Aruna. I really enjoyed chatting with you. And I hope those who were listening took away, important points and important tips to improve immunity, and they can take it into their own hands to improve their immunity. Really appreciate it. You've taken time off on your Saturday morning to do this. Thank you, really. And I hope we can do this again sometime.
absolutely. I look forward to it. It was all my pleasure.
Thank
Thank
you.
you.
Thank you, Aruna. Bye. Bye, everyone.
Bye.
Thank you for joining, and we'll do this again next week. Thank you.